What's up, guys? I'm Dr. Garrett. I'm here at Active Health, here with the lovely Miss Alexis. Alexis, how you doing today?
Good, thank you.
Awesome. You've never been adjusted before. You're a first-time chiropractic patient.
Yeah.
Amazing. So what brought you in?
I was having a lot of shoulder pain, lower back pain. It's hard to sleep at night.
Yeah.
So I just knew something was wrong.
Kind of felt out of alignment.
Yeah.
A lot of, you also had some headaches as well?
Yeah, it was shooting up to my neck, to my head.
Gotcha.
Really bad.
Wow. And what do you do for work?
I'm a waitress, so I'm always standing on my heels.
You're wearing high heels, huh?
High heels. After a while, it hurts and your posture start leaning forward a lot.
Yeah.
So.
You carrying like big heavy trays with a lot of like drinks or food or whatever it might be?
Yeah, I'm constantly like leaning forward, handing a drink, so maybe that too with the heels.
Bending down. Yeah, I gotcha.
Yeah.
So Alexis has an interesting case where you did have a bit of low back pain, but that wasn't her main complaint. It was mainly her upper back, shoulder, and neck area. After examining her, taking x-rays, we found that she has a fracture in her low back. So this is the lateral portion, the side view of Alexis's spine here. And we have this circle here because there's a fracture right at the L5. It is called a pars fracture or a spondylolisthesis. So that is where we have a fracture right through here, and it's not a spondylolisthesis where the vertebral body actually slips forward. So this is a big area that we want to pay extra attention to make sure we don't adjust this area and really focus on working, getting her spine, the red here coming back to the yellow. A lot of the times when patients are wearing heels, it's bringing them up and it arches their back forward, putting more pressure right down here on this lower joint. Alexis, so how are you doing today?
On my shoulders.
Shoulders are a little bit sore? I gotcha. So let's start working on the low back today. Let's start face up, please. So feet are gonna go together. Yep, perfect. Hands off the body. Right over here. So I'm gonna pull this way, you go to the right.
Okay.
Resist here to the right. Woo, we got a winner. Let's check the left side too. I'm gonna pull this way, you go to the left. Resist here. Nice, stronger. Let's start face down. We're gonna work that right side. Already starting to move a little bit, huh? There we go. We're gonna get right in here on the quadratus lumborum muscle attaching from your iliac crest, basically your hip, going on to your lumbar spine, so it helps support your spine.
Which table do you want?
Right in here.
Sure you're good at.
There we go. You okay in here, Alexis?
Yeah.
Nice. A little painful?
Yes, I was here, cement work. So,
Best thing to do during muscle work is just breathe.
Shoulders, you got the shoulders.
Awesome. Got 5, 4, 3, 2, and 1. Awesome. Take a big breath in and out. No help here. Loose, loose, loose. Awesome. Resetting those muscle firing.
Yeah.
Perfect. Now we're going to come right in here. We're going to check the piriformis muscle. You're going to rotate in. Resist in. A little weak there. Let's check this right one too. Resist here. Good. Stronger. So we're going to come in here. Piriformis is an external hip rotator that attaches here on the sacrum and then comes over here onto the femur. Let's come right here. Resist in again. Nice, and it gets stronger. You stay loose in here.
You're just strong, that's why.
Good. Good. So there's a bit of bunching of the muscle here where I'm pushing that muscle onto the bone where it attaches onto the sacrum. And we're doing a lot of these muscle tests. There's tiny, tiny little micro tears where when we test the muscle's not able to facilitate a proper and full contraction. You can still use the muscle, but it starts to fatigue. We don't want to fatigue. 4, 3, 2, and 1. Awesome, Alexis. You stay loosened here. Big breath in and out. Perfect. You hanging in?
Yeah.
You got it. We're gonna distract a little. Yeah. Good. Keep breathing. That's good. There we go. Nice. 5, 4, 3, 2, and 1. Perfect, Alexis. And then relax the feet here. Let's see if we need any movement through here. So moving pretty nicely. A little stuck here. We're gonna bend the leg here. Your knee's gonna fall in this way. There we go. Awesome. Now we're gonna work on that psoas. This is your favorite one, huh?
Mm-hmm.
Perfect. The breath helps so much. If you start focusing on your breath, you stop thinking about the pain so much. There you go. Last bit. There we go. Get into your ribs over here on the right side. Just take your hand, put it behind your neck. Yeah, just like that. We're gonna come in this way. Take a nice big breath in. And out. Wow. That's been out for some time. I'm going to check some of these deep neck muscles in here. They're called the scalene muscles. You're going to lift your chin towards your chest. So lift your head up all the way. Perfect. Rotate right there. And then hold your head here. Resist up. Oh, good try. Rotate here now. And resist up. Oh yeah, so we're gonna have to get on both sides. You relax this way all the way. There we go, just breathe. So the scalene muscles are deep, deep neck flexors here. They attach onto the cervical spine and then insert into the first couple of ribs. Perfect, last 5, 4, 3, 2, and 1. Beautiful. You're going to relax here. Big breath in. Hold your breath for me. No help. This is just a counter strength. Good. Breathe and relax. Now we're going to get this left side. Doing good. This one's a little bit spicier than the right side, huh? We got 5, 4, 3, 2, 2, and 1. There we go. Loose through here. Relax. Perfect. Last one here. Cover the top. Good. You gotta loosen up these upper trap muscles. Because I know they're tight with all the type of work you do. Carrying big heavy trays, bending down, picking things up. Last one. There we go. Good. So we're gonna get the sacrum here. First, we're gonna work the L2. So bring your left side down, Alexis, facing the white wall for me. There you go. Leg straight. One more slide. Good. So we're going up higher, staying away from that spondy here. We're just gonna tuck you back to take out that curve that's coming in the front. Good. Right there. Loose through this way. Your shoulders are coming back here. There you go. Loose. Excellent. Come on over this way. So we're going to contact low on the sacrum here. Wow. That was massive. You okay there?
Yeah.
We're going to get your mid back now. We're going to come right through this way. Good. Right in here. Perfect. Take a big breath in. And out all the way. Loose through. Nice. Everything's moving.
Yeah.
You've been icing, huh?
Mhm.
Good. We need to ice the body because as we're adjusting through scar tissue. It creates just a very small layer of inflammation, and so we just need to ice in through here, especially with all that muscle work.
Yeah.
Let's start here. We're going to go C2. Relax in this way. Nice and loose like this. Good. Coming in this way. Right through here. Loose. Amazing. This way. You crushed it today, girl. Never been before. What would you say to all those people out there that have never been adjusted? Maybe they're afraid of chiropractic, or they just have no idea what it's about. What would you say?
Say just go and do it because it's life changing. Like really makes a big difference in your health and your everyday life. Yeah,
Nice.
definitely recommend it.
You're awesome. Good job, Alexis.
Thank you.
Let's get you on traction.